the whole cycle of human being, from birth up to the person is old from birth. So if a child is born, we encourage that the child should be put to breast for the first 30 minutes. If that is not done, then the child will grow without the ability to make certain crucial enzymes and certain factors in the body, and hence due for feeble-mindedness and a host of other illnesses. You understand? So we encourage that the child is put to breast for the first 30 minutes. Then after that 30 minutes, we encourage what? Continue breastfeeding up to 6 months without anything given to the child except medically indicated. We encourage that the child should just be on breast milk. When that is done after 6 months, then we now start to what? To introduce other things for the child to incorporate it to the breast milk. I think the purpose for this is important because if you look at our whole cycle and our developmental milestone, we have recorded a lot of diseases which directly or indirectly is due to some of this under breastfeeding. For example, cardiovascular diseases. It is recorded and scientifically proven that people with cardiovascular disease have a trace history of what? Poor breastfeeding. There are a lot of people who are suffering from cardiac disease because they were not well breastfed. So they were given carbohydrates, breast milk substitutes, and that has not given them good system to be able to carry adult life. We have recorded abortive pregnancies because of poor breastfeeding. Realize that even when a child is well breastfed, the mother is prevented from cancer. Breast cancers, most breast cancers are due to poor breastfeeding. When the child is not breastfed, and cervical cancers are all, most of which due to breastfeeding. We also realize that breast milk is cheap. You don't buy it, you just put the child to breast. If you compare it to breast milk substitute, you realize that the cost-benefit ratio cannot be overemphasized. So that alone, even our environment, you realize that with breastfeeding, adequate mothers not buying breast milk substitute, our environment will be free of what? Of the containers containing the breast milk substitute. So the purpose, the reasons are numerous, and for purposes of this one, we shall simply give this few importance to the media. But we are continuing educating mothers and fathers because it's a whole teamwork. The whole family must be involved. The father, the mother, the grandparents must breastfeed. If we leave breast milk or breastfeeding to the mother alone, it will not work. It's a whole social support program that the whole family should support. Even the child's sibling, you should breastfeed at least 12 or on demand. We give this 12 times because we just want to set a high target for breastfeeding, but it is on demand. You breastfeed on any time the child needs, day and night the child must be breastfed. And you don't give anything apart from what? The breast milk. So basically, that is what we have for you. Thank you so much.